Gilles Pajot, who is the former executive vice president of IMS. And Gilles is really, really... Yeah, Gilles, just pick up a micro. Yeah. So Gilles, okay, guys, we've got an issue. How do you tackle this?
I have to say one thing coming from the US. They used to say there, if you cannot convince, confuse. And I think we'll be very good in the next few minutes to help you be confused on those issues. However, confusion is coming from the very high level of complexity that you have already brought up. Let me do two things quickly. Address the healthcare challenges. Today they are huge and they are growing. However, it gives you a lot of opportunities, and you'll need a broad spectrum of capabilities to deal with those potential opportunities. And I will focus on two of those. One is information, and the other one is technology. Let me say first that healthcare today is on the top of any political agenda. And even if we are in Europe, and in Europe we talk a lot about healthcare, go to the US, this is the main topic probably. And there is a reason why. And this is going to grow. The reason is, on one hand, the demand is growing, of course. The most obvious reason is the aging population, no doubt about that. The offering is growing. You can see innovation in many different areas, new drugs, new devices, new equipments, new procedures. No doubt. On one hand, you have this huge growth. On the other hand, the financing is getting more and more limited. And today, when you look at the limitation, is getting dramatic. Dramatic for two reasons. On one hand, you have the debt growing. On the other hand, you have the budget deficit growing. Both of them have been doubled in the EU the last 5 years. So you have a huge gap. What do you do with that gap? So, and how does it translate in real life? It translates in real life in a very simple world. You know, everyone dealing with the healthcare has to make trade-off between three different dimensions. One is access. Everybody wants to have access to healthcare. That would be critical. And there's a lot of issues to have access to healthcare also, and legal issues behind it too. The second one is quality. And the third one is cost. So you have to make trade-off, and sometimes you cannot even make a trade-off. You have to choose between one of the three. So that's a real challenge. The third aspect of it is, are there ways to address those issues? Yes, there are ways. The way to the preconditions for me is to define a common agenda between the healthcare stakeholders, meaning the governments, the providers, the payers, the regulators. Today, they are not working on the same agenda. Sometimes they are working against each other. A while ago, the providers could do whatever they wanted. Today, the payers are basically the kings with the regulators. So you've got to get a common agenda. But this common agenda should be guided towards only one target, the patient. Everything should happen at the patient level later. We just forgot that. So with that, I would say, what do you have to solve these issues? You have basically all the innovation I've been talking about, but you have three other different dimensions and capabilities. And you should, one is intelligence. What do I mean by intelligence? I mean the systems, the infrastructure, the people. The second is technology. The third one is information. We talked about information, and I've spent 10 years of my life in information. Information is absolutely critical. Why? Why is it so critical? Why is it so critical? It's critical for basically a couple of reasons, because information helps you to understand and measure. But here is critical, first of all, because you want to decide upon the behavior of people in healthcare. People behave the way they are measured. So that's critical on that one. The number two, you got to be able, if you want to improve anything, you got to assess where you are and monitor progress. So you got to measure. Where do you apply information? You apply it in two different areas. One is to make policies. The policymakers need badly information. The right information, we'll come back to that, but they need it. But you should also use information at another level. You should use information to make decisions at the patient level, at the point of care. And that's even more important, I would say, at the end of the day. But this is extremely important. So you have basically the two ends of the spectrum. So information, we said, they should be few things. They should be timely. That's a big, big problem, to have information which are that you got 5 years ago to make decision today. So that's a real issue. They should be very high quality, no doubt about that. But those information have there are few other aspects to get there. You talk about getting simple, standardized information. This is a nightmare. The nightmare comes from capturing those data. What do you do when you capture those data? There are so many ways to do it. Technology is helping a lot. Even with mobile technology today, you can access to a lot of data you couldn't do yesterday. And then you got to do so much things about between data and information. Cleansing, bridging, clothing, and coding. This is a long process to get to the information. When you have the information, nothing is standardized yet. So you have to go through a standardized process. And standardized process is going to give you what? It's going to give you the way to get analysis and get insights. So you get, again, another process to deal with the data. However, this is great. This data should be, first of all, relevant. So we have a lot of data today which you don't need. You can get rid of a lot of data. What are the most important data today? They are the patient data. Back again to the patient data. They should be done at the patient data level. Otherwise, there is no interest. This is where you see the treatment patterns. This is where you can measure real, actual healthcare outcomes. This is where you can monitor safety and risk management there. This is the way you can understand the untreated population. So at the patient level data, they should also not be a one-time shot. They should be longitudinal patient data. So you should be able to capture over time the different data for a given patient and capture each of the healthcare episode he has got. Otherwise, there is no value. However, this is a nice story, but the lawyers tell you you can't do anything, because this is all about this is all about about privacy, and you cannot cope with that if you don't get equipped to anonymize your data. Actually, we should never talk about patient-level data. We should talk about anonymized patient-level data. We should get that in the language, because today, and also define what does it mean. They are process of anonymization. They are technology of encryption. There are a lot of ways to get at privacy, but you got to comply with the privacy. That's a precondition to get there. This is a necessity. However, we got to deal with the issues of privacy. Another one I want to mention, which is not also a lawyer issue. Who owns the data? If you go to England, you can spend your full day to try to figure out who owns the data, and then you can get back to square one. So here you have a huge set of possibilities when you deal with that. However, you got to understand the limitations, and you got to be ready for those.
I have a question for you. With respect to your experience, both each side of the Atlantic, do you think that data privacy regulation under EU laws are protective, obstacles, versus a US regime, which is slightly different?
No, I think this is very interesting. The whole story started in Europe for obvious reasons. We are more regulated countries than the US are, more open on that, and they also had the free act of information when you could access any information. So the whole thing started in Europe. So the foundation of privacy laws started in Europe. Actually, the French have been very good. Well, what can you expect with the administration we have here? So started under Germans. England is bouncing around. However, the US has also understood that pretty well recently, and basically understanding also that you had to collect data around the world. You had to have a community of understanding, and then US is migrating towards Europe on that. And actually there is a fair amount of understanding here, a good deal, and the last few debates have been far better. So I think I'm very confident about that. But what is more interesting, I would say, is if you go to China now. When the Chinese have decided to get electronic health records. They want 70% of their population in 20 years with 70% of the population with electronic health records, and they want them standardized. They are trying to standardize them at the very beginning when they collect them. However, what they did, they went around the world. They went a lot in Europe, a little bit in US, and learned about privacy. And today, they do comply with the privacy law better than anybody else. And what I can see coming, they are going to set up the standards. They are going to set up the standards. And we might, in a few, give another 5 years. And I wouldn't be surprised that the standards are coming from them. They might own them. So that's a real issue. So the world is coming together in a funny way.
Well, thank you very much, Gilles. And the last word on that, because I see it's just such a fascinating
but there is
topic
another thing. So you talk about information. This is fabulous. When you combine information and technology, we have just debated. Now, we are working on something else, which is combining intelligence and technology. And intelligence, again, when we talk about intelligence, healthcare, a lot has to do with the people.
Yeah.
And you're going to hear from the next speaker, who has been with Alexandre Mignon and the Descartes University and Dassault Systèmes pioneering this product. But you'll see there what you can get out of that. And what I want to ask you, there is there are also a lot of regulations coming out of that.
Yeah.
And you can set up standards, and you can decide upon those standards, because it's all about what you said before. You got to comply with privacy, but you should be able to set up standards. And the world of healthcare will not improve without this, necessity and the ability to set up standards. I could go on for another hour if you want.
I trust you. Thank you very much, Gilles.